Sometimes in Washington, you feel like there's nothing anyone can agree on. But one thing we can all agree on, no matter what your party, is that health care is too expensive. I'm a doctor who worked in the hospital, public hospital system for the working uninsured and the poorly insured. And it's not just the poor, it's also middle-income Americans who have a really hard time right now of affording their health care. Now, there's a little bit of an irony here. Obamacare came into existence, and it was supposed to decrease premiums by $2,400 a year. And since then, premiums have probably risen, I don't know, in the aggregate, 100% since that law was passed. And part of this is waste, fraud, and abuse of taxpayer dollars. So we're paying higher premiums, and the taxpayer's getting ripped off as well. Just some recent examples. In November, a federal jury in West Palm Beach convicted 2 individuals in a $233 million Obamacare fraudulent enrollment scheme. Earlier this year, the Centers for Medicare and Medicaid Services identified 2.8 million duplicate enrollments across Medicaid and Obamacare, which waste an estimated $14 billion annually. And just a few weeks ago, the Government Accountability Office released a report highlighting likely significant fraud in the Obamacare marketplaces due to lack of proper verification. In this, by the way, the GAO put up shoddy data on purpose to see if it would be accepted, and it was accepted across the board, even though they came nowhere close to providing the information they were supposed to provide. Now, the American people want lower health care costs, and they also want us to protect their taxpayer dollar from fraud and abuse. So we need a health care system that protects patients and families but doesn't reward a get-rich-quick by any means fraudster looking to get an extra buck from the federal taxpayer. That's why Republicans have focused on a way forward on health care that actually lowers costs, fights fraud, and gives power to the patient, not profit to the insurance company, not ill-gotten gains to the criminal. Now, my Democratic colleagues are about to put up a resolution, which would do a Congressional Review Act on a recent rule put out by the administration to fight waste, fraud, and abuse. For whatever reason, this resolution wants to fighting waste, fraud, and abuse. And if the CRA passes, it'll eliminate common sense measures for waste, fraud, and abuse, to eliminate them, to at least address them, as well as safeguards ensuring that subsidies go to patients who qualify, those who need it to afford coverage. By the way, the resolution being offered by my Democratic colleagues will raise insurance premiums by 5%. They're offering a CRA that raises premiums the effect of by 5%. That's money that a family could use to pay their car note, their flood insurance note, their grocery bill, you name it, rent for their apartment, and instead it's going to insurance companies. Now, I don't quite know why my Democratic colleagues are so entrenched in protecting a broken system. They are willing to raise premiums 5% to protect the status quo. Now, as I said, I'm a doctor who worked in the public hospital system for over 20 years, trying to bring health care to people who otherwise couldn't afford. Let's work together. Let's find a solution that actually lowers costs, doesn't increase premiums. Let's find a solution which squeezes out waste, which eliminates and prosecutes fraud, not a system in which they are rewarded. So, as a doctor, as a conservative, as an American, as a steward of when I say federal taxpayer, I mean you and me and everybody watching and everyone in the gallery. Let's steward that money correctly. I urge my colleagues to reject this resolution and continue with bipartisan, important work to make health care more affordable. With that, I yield.